of late Varur Srinivasan Vaidya.
In 2010, Ahalia Ayurveda Medical College was established after realizing the real potential of Ahalia Ayurveda Hospital to flourish into an eminent Gurukula.
Ayurvedic treatment gets a new dimension in Ahalia Ayurveda Lakeview cottages and mini cottages where well surrounded by a vast range of flora and fauna.
Ahalia is always focused and progressing to provide international quality and facilities to our guests. As a result, we introduce PG Block with premium deluxe rooms in 2025. Ahalia Ayurveda seems to focus on holistic healing through Ayurvedic practices. Wellness-oriented approaches can be really beneficial for overall health. The Ahalia Wellness Center is the next stepping stone, focusing the ultimate ultra-luxurious wellness retreat.
Heading towards the inaugural session, I request the chief guest of the day, Dr. J.S. Bhuvaneshwaran, Director of PSG Hospitals, to kindly step forward and be seated on the dais. Please, sir. Dr. J.S. Bhuvaneshwaran, an acclaimed cardiologist and healthcare leader, is a true pioneer in his field. With an MD from Manipal University and a DM in cardiology from Sri Chitra Tirunal University, Trivandrum, Dr. Bhuvaneshwaran blends clinical excellence with strategic vision. He also holds an MBA from PSG Hospitals and Tamil Nadu Open University and currently serves as director at PSG Hospitals, where he has been instrumental in modernizing infrastructure and delivering exceptional patient care. Dr. J.S. Bhuvaneshwaran is a fellow of the American College of Cardiology and the European Society of Cardiology and holds certification from SASAT USA, underscoring his global recognition. His presence today is not just an honor, it's an opportunity to learn from a legacy of expertise and dedication. Once again, we welcome you, sir.
I also invite the following dignitaries to kindly seated to this podium. Dr. Suresh Babu, Chief Medical Director, Ahalia Group of Hospitals. Dr. Ajisham Pillai, Director and Senior Consultant, Ahalia Wellness. Dr. Sheba Sunil, Principal, Ahalia Ayurveda Medical College Hospital. Dr. C.M. Kunyahmad, Senior Consultant, Ahalia Ayurveda Medical College Hospital. Dr. Sunil Kumar, Vice Principal, Ahalia Ayurveda Medical College Hospital. Dr. Sarojisha E.V., Senior Consultant, Ahalia Ayurveda Medical College Hospital. I also invite Dr. Krishnan Nambudiri, cardiologist, Ahalia Diabetes Hospital, to kindly seated to the podium. Sir, please. Before we proceed, let us take a moment to invoke blessings and peace for our gathering. I request everyone to bow up for the prayer.
இந்நிகழ்வின் தொடக்கமாக இறைவணக்கம். அனைவரும் எழுந்து நின்று இறைவணக்கம் செலுத்துமாறு அன்புடன் வேண்டுகிறோம்.
നന്മയാകുന്ന കാന്തി കാണുവാൻ കണ്ണിനാകേണമേ നല്ല വാക്കിൻ്റെ ശീലു ചൊല്ലുവാൻ നാവിനാകേണമേ സ്നേഹമാകുന്ന ഗീതമോ എൻ്റെ കാതിനിണയാകണേ
I invite Mr. Shibu Rajendran, Administrator, Ahalia Ayurveda Medical College Hospital, for the welcome speech.
A very good evening to all 100 present here on the dais and off dais. It gives me immense pleasure to extend a warm welcome to all you to Sangamam 2K25 Ayu Conclave. This wonderful gathering is visioned as an unofficial get-together of our cherished guests, well-wishers, and committed social activists, a space for connection, reflection, and celebration. Let me take a moment to speak about our journey. Ahalia Ayurveda Hospital, established in the memory of Sri Varu Srinivasa Vaidyar, physician, visionary, social worker, and a loving father of our Honorable Chairman Sir, Dr. V.S. Gopal Sir. Started as a traditional Ayurveda hospital in 2006, we have stepped into Ahalia Ayurveda Medical College Hospital as our first stone to success in the year 2010. In between, we have achieved our own dedicated medicine manufacturing unit, Ahalia Medicine Manufacturing Unit, named as AMU, in 2007. In 2011, it is one of our proud milestones that we have become the first Ayurveda hospital NABH in India. In 2013, we established the Lake House cottages. In 2020, mini cottages, and 2023, mini lake houses, which have as opportunity to enhance patient care through natural and holistic atmosphere and focusing on to Ayurveda for common people. And now we step into a new chapter, our new block with the premium deluxe rooms and Ahalia Wellness Retreat dedicated to complete well-being, combining traditions, comfort, the future of Ayurveda. On this occasion, I take immense pride in welcoming our esteemed dignitaries on the stage. Welcome Dr. Bhuvaneswaran Sir, our Chief Guest of Honor and the respected Managing Trustee of PSG Hospital. Welcome, sir. Heartily welcome to this event. Thank you, sir. Then our Medical Director, Ahalia Hospital, Dr. Suresh Sir. Welcome this program, sir. And our Wellness Director and the Senior Consultant of Ayurveda Medical College Hospital, Dr. Ajay Shampillai. Welcome in this program, sir. Dr. Shabaz Sunil, Principal, Ayurveda Medical College Hospital, also welcome in this program. Then our Senior Consultant, Dr. Kunyamat Sir. Heartily welcome to this event. Thus, our Vice Principal, Dr. Sunil, Ahalia Ayurveda Medical College. Heartily welcome to this program, sir. And Swaraj Sir, Senior Consultant and Manager, Ahalia Medicine Manufacturing Unit. Heartily welcome to this event, sir. And of course, a health welcome to all our guests, well-wishers, and everyone present here today. I sincerely hope you find this evening informative, engaging, and memorable. Once a warm welcome to Sangam 2025. Thanks to all.
Thank you, sir. I would like to invite Dr. Ajisham Pillai, Director and Senior Consultant, Ahalia Wellness, for the Presidential Address. Sir, please.
Good evening, everybody. Today, we are celebrating or rather organizing a function known as Sangamam. So the Ahalia Ayurveda Hospital and Ahalia as such, we have been functioning for the past around 20 years now. And in this period of time, we have grown from a small level, and today we have achieved a good status throughout this country. So we are getting patients throughout our country, and we have even guests who have come here from Chennai. So first of all, let me just lead you through a little bit of our development. So initially, we started off as a hospital. The patients were very few. Slowly, one by one, the patients started coming in, and one of our main target audiences initially was Pollachi and Dharapuram. From then on, we moved to other places like Tirupur, Erode, Salem. Coimbatore was a hard nut to crack, but eventually it cracked. And Coimbatore is also now coming in. And now we have started the wellness division. This wellness division is meant to enhance Ayurveda in a new way. We believe in going hand in hand with modern medicine also. So we want to modernize Ayurveda. We want to establish Ayurveda as a part of modern science also. And I was talking to Dr. J.S. Bhuvaneshwaran some time back, and he also mentioned how PSG group is also adopting such things like they have a 5 yoni. It's a 5 yoni that's thinking what's about that for these things. He will tell you about in detail. So first of all, let me express my joy in having such a personality out here to inaugurate our function. So as we all know, as the comparator said, Dr. J.S. Bhuvaneshwaran is a renowned cardiologist and healthcare leader. Dr. J.S. Bhuvaneshwaran had his educational qualification, Doctor of Medicine in Manipal University, Master of Business Administration, PSC Hospital and Tamil Nadu Open University. He did his DM in cardiology from Sri Chittura Institute of Medical Sciences. And he also has the following certifications like Fellow of the American College of Cardiology, Fellow of the European Society of Cardiology, and he's also certified by SASAT USA. So in his professional experience, he has been closely associated with Ahalia. He was the director of Ahalia, Hamdan and Musafa, and presently he's also the director of PSC Hospital. And apart from this, yesterday, like I told him, one of my patients in my OP, when I was talking about this thing, and I told him Dr. Bhuvaneshwaran is coming to inaugurate our functions. He said, he comes from my hometown, Gobi Chettipalayam. He's a good singer also. So I expect maybe if we have the good fortune, he could express some of his songs to us out here. And at the same time, I also acknowledge the other persons on the dais. Dr. Sarvodisha, Dr. Sunil, Dr. Suresh Babu, our CMD, our principal, Dr. Sheba Sunil, and of course, yes, my close friend and associate, Dr. Kunjamat, is also a senior consultant. So having said these words, I would like to call upon Dr. J.S. Bhuvaneshwaran to light the lamp and inaugurate our function, also deliver a few of his very important words. Thank you.
I invite all the honorable dignitaries to kindly step forward for lamp lighting ceremony.
I would like to invite our chief guest of the day, Dr. J.S. Bhuvaneshwaran, Director, PSG Hospitals, for the inaugural address. Sir, please.
Krishna ni begane baro, Krishna ni begane baro, begane baro, mukhavalle toro begane baro, mukhavalle toro, Krishna ni begane baro. Okay, yeah. Should I talk in English or Malayalam or Tamil? പിന്നെ നമ്മൾ കലർന്ന് സംസാരിക്കാം അല്ല അത് ബെറ്ററാണ്. സോ ദ എസ്റ്റീംഡ് പീപ്പിൾ ഓഫ് ഡിഫറെൻറ്റ് പൊസിഷൻസ് ആൻഡ് എംപവർമെൻറ്റ് ഇൻ Ahalia, നമസ്കാരം. My dear Dr. Krishan sir, dear people from various places who have been taking treatment in Ahalia Ayurvedic Center and Wellness, and namaskaram. I am a part of Ahalia. That's to correctly say that I am not a guest here. Because ഞാൻ ഫസ്റ്റ് ഇവിടെ ഈ ക്യാമ്പസിന് ഞാൻ ഫസ്റ്റ് വന്നത് 2005 2005 ഫസ്റ്റ് ഞാൻ ഇവിടെ ഈ ക്യാമ്പസിന് ഒരു വിസിറ്റിനെ സാറ് വിളിച്ചിട്ട് ഞാനിവിടെ വന്നു. അപ്പോഴാണ് ക്യാമ്പസ് തുടങ്ങിയ ദാറ്റ്സ് ജസ്റ്റ് ദ ടൈം ഐ തിങ്ക് ഇറ്റ് വാസ് ജസ്റ്റ് ഗെറ്റിംഗ് എസ്റ്റാബ്ലിഷ്ഡ്. അതിന് ശേഷം കുറേ പ്രാവശ്യങ്ങൾ ഇവിടെ വന്നിട്ടുണ്ട്. ദെൻ നമ്മൾ 2013 തൊട്ട് 2019 വരെ ഞാൻ അഹല്യയുടെ അബുദാബി ഓപ്പറേഷൻസിനെ ഒരു പാർട്ടായിരുന്നു. അതിനാണ് മെഡിക്കൽ ഡയറക്ടറായിട്ടിരുന്നു. അവിടെയാണ് ഞാൻ നമ്മുടെ ഡോക്ടർ സുരേഷ് ഈസ് അവർ സ്റ്റുഡൻറ്റ് ഫ്രം PSG മെഡിക്കൽ. സോ ഞങ്ങളുടെ സ്റ്റുഡൻ്റാണ് കം മൈ എസ്റ്റീംഡ് കലീഗ്. നിങ്ങളെ ഉള്ള ആൾക്കാരുടെ കുറേ ആൾക്കാർ ഞങ്ങൾക്ക് പരിചയമാണ്. ആൻഡ് ഐ എം വെരി ഹാപ്പി ദാറ്റ് the campus, in a way, it reflects my guru, my mentor, Dr. Gopal sir. Because he is a person with a multidimensional intelligence. He is like literally like this lamp. He has different aspects of life which he approaches with his cosmic intelligence. And Sir is obviously for Sarada Achanana Barur Srinivasan Sarada Achanana. On that basis only I think this hospital has been established. Actually speaking, നമ്മുടെ പാരമ്പര്യ വൈദ്യം എന്ന് പറയുമ്പോൾ Ayurveda is a part of our Vedas. In fact, Ayurveda is one of the Upavedas. It's a part of our Vedas. And the approach of treatment in Ayurveda is based on the scientific principle of Tridoshas. Whereas fortunately or unfortunately we have been 400 years, 500 years, 400 years we were ruled by the colonial British, and currently we follow the active treatment principles of the Western science, which we call it as allopathy, which has a very good solution for many of our ailments, but not for all ailments. That means, in my opinion, as well as many of us understand, for many situations, except emergencies, chronic issues, there are no proper treatment options available. In fact, I am from a family of homeopaths. In fact, I still actively follow homeopathy in my household remedies. We take Ayurvedic preparations for our household. We take the Western medicines also. What we now call it as integrated medicine approach. In fact, I was talking to your senior sir that PSG in 2008, when I was medical director, we started the first yoga and naturopathy clinic in PSG. Since then, till date, we have a very active yoga and naturopathy. See, in naturopathy, as you know, there are no ingredients or medicines inside. Our cheyyunnathellam, which is the Panchabhutas concept, the sunshine, water, steam, mud. There are external applications. Internal medicines generally with yoga, and this is yoga naturopathy. Now we are contemplating to start a department of integrated medicine with Ayurveda also inclusive. The process is on. And I am very happy to say that for the first time in this country, probably in the part of the world, we have introduced a new concept of Panchakosha based master health checkup. Now what is that? See, normally master health checkup you know what they do. Then they will take your physical examination. Then they do certain examinations and tell, okay, you have diabetes, you have hypertension. But Panchakosha based, in which a regular master health checkup, plus you know that our Upanishads say that a human person or human body is to be looked at as a conceptually as a constituent of 5 sheaths. A physical body called as Annamaya Kosha, that is the food what we eat, this body. Pranamaya Kosha or energy body, because everything is finally oxygen and what we call it as a ATP, adenosine triphosphate inside the cell, which is requires oxygen for it to be effective in producing proteins, etc. So called Pranamaya Kosha, energy body, which is through the breath. The third one is called as Manomaya Kosha or the mind body. You know that mind body is generally approached through psychology in the modern medicine. But in a master health checkup, it is not given a big importance. Generally, they ask you a couple of questions. How are you? How do you feel? Do you get a good sleep? Then they stop with that. The fourth one is called as Vijnanamaya Kosha, which is in English translated as intellectual body, but it's a body of wisdom. The body of wisdom, it is not intelligence. It's more than intelligence. It is the wisdom, intelligence which is matured over time. And the final one is called as bliss body or Anandamaya Kosha, which are a little difficult for us to perceive, but it is the bliss body, what we call it as somebody who has been in a state of bliss or happiness, which is internal. So we have scientifically done evaluation with a team of experts. We have formed certain questionnaires and we have combined everything, validated it scientifically in a statistical study. It is due for publication, being written up. And now we have introduced as Panchamaya Kosha, Panchakosha based master health checkup. So this is exactly what we should look at. What I mean to say, there is no exclusive medicine. With one medicine, you cannot cure everything. It's impossible. So there is nothing like alternate medicine. Every medicine is complementary to each other. Ayurveda can complement Western medicine can complement homeopathy. So if we look at all that as our fingers, they are not like this, they are like this. See, this is something, one is looking in one direction. But when you do this, they are all together formatted, and that is the blessing which, as treating doctors, healers, we should give it to the community. In that way, I'm very happy that Ahalia is doing a wonderful job, a beautiful campus. You have diabetes hospital, women and children, Ayurvedic hospital, and Ayurvedic drug factory, so many things, green initiatives, 15 lakes. I mean, this is the place itself. Once you walk in, you probably start getting the nature healing you. And I'm extremely thankful to the management, to Sir and Sir's family and the authorities here, and dear friends here, to have invited me to be a part of you, to meet up with my Chetan here. And I'm very happy to see so many of you. I will be very happy to interact with you also with some question answers if it is there as a part of the session. And with all that, I thank the Almighty for creating this wonderful evening for all of us. Thank you. God bless all.
Thank you, sir. I now invite Dr. Suresh Babu, Chief Medical Director, Ahalia Group of Hospitals, for honoring the distinguished chief guest. I also invite Dr. J.S. Bhuvaneshwaran, Chief Guest of the Day, for receiving the honor.
எல்லாருக்கும் வணக்கம். ரெஸ்பெக்டட் டாக்டர் புவன் சார், கிருஷ்ணன் சார், அஜீஷ் பிள்ளை சார், டாக்டர் குஞ்சாமது, டாக்டர் ஷபா சுனில், டாக்டர் சுனில் அண்டு டாக்டர் சரோசிஷா, அப்புறம் அந்த சங்கமம் ப்ரோக்ராமுக்காக இங்கே வந்து சிறப்பு விருந்தினர்களை வந்திருக்கவங்க எல்லாருக்கும் வருக வருக என்று அகலியா மருத்துவ குழுவின் சார்பாக வரவேற்கிறேன். புவன் சாரை பற்றி சொல்லணுன்னா, புவன் சார், கிருஷ்ணன் சார் மாதிரி ஆசிரியர்கள், மருத்துவ ஆசிரியர்கள் வந்து ரொம்ப அரிதாக இருக்காங்க. அவங்க கீழே நாங்கள் படித்தோங்கிறது எங்களோட அதிர்ஷ்டம் தான் சொல்லணும். எங்கள் என்டையர் பேட்ச் அவருக்கு கடமைப்பட்டிருக்கோம். அவர்கிட்டருந்து படித்தது தான் நாங்கள் இப்போ ப்ராக்டிஸ் பண்ணிகிட்ருக்கோம். அதே மாதிரி கிருஷ்ணன் சார் இப்போ மருத்துவமனையில் தான் எங்களுக்கான அசோசியேஷன் இருக்குது. ஆனால் நான் படித்தது எல்லாமே வந்து ஒன்றுமே இல்லை. அவர் பேசுகிறதுக்கு முன்னால் ஒன்றுமே இல்லைங்கிறது அவரோட ரவுண்ட்ஸ் போகும்போது தெரியுது. அந்தளவுக்கு அவங்களோட எக்ஸ்பீரியன்ஸும் அந்த இதுவும் வந்து அவங்களுக்கு கீழே நாங்கள் வேலை செய்கிறோங்கிறது எங்களுக்கு ரொம்ப பெருமை. ஸோ அந்த மாதிரி மருத்துவ ஆசிரியர்கள் இப்போ ரொம்ப அரிதாயிட்டு வர்றாங்க. ஸோ இருக்கும்போதே அவங்கள எல்லாம் நம்ம வந்து பொக்கிஷமாக பாராட்டி அவங்கள போற்றணுங்கிறது என்னுடைய தாழ்மையான அபிப்பிராயம். அப்புறம் டாக்டர் அஜீஷ் பிள்ளை பற்றி சொல்லணுன்னா, இந்த சங்கமம், இந்த ஆயுர்வேத வெல்னஸுக்கு ஒரு பயனீர், ஒரு பெரிய தூண் அப்படின்னு அவரை தான் சொல்லணும். அவர் தான் வந்து இந்த ப்ரோக்ராமை டிசைன் பண்ணி ஒரு வெல்னஸ் க்ரியேட் பண்ணியிருக்காரு. அலோபதி சார்பாக அகலியா டயபிட்டிஸ் ஹாஸ்பிட்டல், விமன் அண்ட் சில்ட்ரன் ஹாஸ்பிட்டலெல்லாம் நாங்கள் பார்த்துட்ருக்கோம். ஸோ வெல்னஸ் ப்ரோக்ராமில் அலோபதியில் எங்கள் சைட்லேருந்து எவ்வளோ பண்ண முடியுமோ அல்டிமேட்லி நம்ம பேஷண்ட்டோட வெல்னஸ் தான் முக்கியம். அது எந்த ரூபத்தில் வந்தாலும் பேஷண்ட்டு கடைசியில் இந்த கேம்பஸ் விட்டு வெளியில் போகும்போது அவங்க உள்ளே வரும்போது என்னென்ன தொந்தரவு இருந்ததோ அதை கம்ப்ளீட்டாக நிவாரணமாகி ஒரு ரெஜுவினேஷனோட வெளியில் போகணுங்கிறது தான் எங்களோட அபிப்பிராயம். அதில் நிச்சயமாக ஆயுர்வேதத்துக்கு ஒரு பெரிய பங்கு இருக்குது. கூடவே நாங்கள் அலோபதியில் எங்கள் மருத்துவ குழுமோ அதுக்கு எல்லா விதத்திலும் உதவி செய்வோங்கிறத இந்த இடத்துல உறுதியாக சொல்லிக்கிறேன். ஆயுர்வேதம் அலோபதிங்கிறது இல்லை, எல்லாருக்கும் தெரிஞ்ச மாதிரி அல்டிமேட்டாக நமக்கு வேண்டியது பேஷண்ட் கேர், எல்லாருடைய நல்வாழ்வு, மறுவாழ்வு, நல்வாழ்வு, ரெஜுவினேஷன் எப்படி வேணால் சொல்லலாம். அந்த விதத்தில் இந்த சங்கமம் அப்படிங்கிறது, இந்த வெல்னஸ் ப்ரோக்ராம் இங்கே தொடங்கியிருக்கோம். அது எல்லாம் நல்லபடியாக நடக்கிறதுக்கு எல்லாம் வல்ல இறைவனை பிரார்த்தி கொண்டு விடைபெறுகிறேன். நன்றி, வணக்கம்.
Thank you, sir. I invite Dr. Sheba Sunil, Principal, Professor and HOD, Department of Prasuti Tantra and Stri Roga, Ahalia Ayurveda Medical College Hospital, for the felicitation.
Respected Chief Guest Dr. J.S. Bhuvaneshwar, Director, PSG Hospitals, and all my Ahalia family members, a warm good evening to all gathered here, and I'm extremely happy to see all our well-wishers in this beautiful evening. Thank you all for accepting our invitation to the Ayu Conclave Sangamam. I would like to inform you that an Ayurveda college, Ahalia Ayurveda Medical College is working here, and more than 300 students are studying Ayurveda. The college is equipped with all facilities, and eminent doctors with high qualifications in all specialties are working here. Now we have started a wellness center under the guidance of Dr. Ajesh. And as you know, wellness means active pursuit of activities, choices, and lifestyles that lead to a holistic health and well-being. It is more than just the absence of illness. It is a positive approach to living that includes physical, mental, and social well-being. Wellness is a personal and subjective journey influenced by individual choices and surrounding environment. It is a valuable resource that allows people to lead individually, socially, and economically productive life. Ayurveda, often called as science of life, it deeply emphasizes the connection between human body and environment. Both are composed of Panjabhutas. So, depends upon Ayurvedic principles, we offer a healthy state of mind and body through our wellness center. So, I invite you all to experience our treatments, facilities for a healthy living. And I wish all the best to this conclave, and thank you so much.
Thank you, ma'am. I would like to invite Dr. C. Kuny Ahmed, Senior Consultant, Ahalia Ayurveda Medical College Hospital, for the felicitation.
Hello, very good evening to all. എല്ലാവരും ഇംഗ്ലീഷിൽ പറയുമ്പോൾ ഞാൻ മലയാളത്തിൽ പറയാമെന്ന് വിചാരിച്ചു. ബഹുമാനപ്പെട്ട ഈ വേദിയിലില്ലെങ്കിലും നമ്മുടെയൊക്കെ നെടുന്തൂണായ ഡോക്ടർ ഗോപാൽ സാർ, അതേപോലെ തന്നെ ഇന്നത്തെ മുഖ്യാതിഥി ഡോക്ടർ ഭുവനേശ്വർ സാർ, അതേപോലെ അഹല്യ മെഡിക്കൽ ഡയറക്ടർ സുരേഷ് ബാബു സാർ, പ്രിൻസിപ്പൽ ഷെബ മാം, ഡോക്ടർ അജേഷ്, സുനിൽ ആൻഡ് സ്വരോജേഷ, മറ്റ് നമ്മുടെ ക്ഷണം സ്വീകരിച്ച് ഇവിടെ വന്നിരിക്കുന്ന എല്ലാ വിശിഷ്ടാതിഥികളെയും ഞാൻ ഈ പരിപാടിയിലേക്ക് ഹാർദവമായി സ്വാഗതം ചെയ്യുന്നു. നമ്മളെല്ലാവരും കുറേ വർഷങ്ങളായി പ്രയത്നിച്ചു കൊണ്ടിരിക്കുന്നതും വിഭാവനം ചെയ്യുന്നതുമായ ഒരു നിലയിലേക്ക് നമ്മുടെ സ്ഥാപനം വളർന്നിരിക്കുന്നു. ആയുർവേദ ഹോസ്പിറ്റലിൽ നിന്നും, ആദ്യകാല ആയുർവേദ ഹോസ്പിറ്റലിൽ നിന്നും അഹല്യ ആയുർവേദ മെഡിക്കൽ കോളേജിലേക്കും ഇപ്പോൾ അഹല്യ വെൽനസ് സെൻറ്ററിലേക്കും പടിപടിയായി വളർന്നുകൊണ്ടിരിക്കുന്നു. ഈ സന്ദർഭത്തിൽ വളരെ സന്തോഷത്തോടെയും അഭിമാനത്തോടെയും കൂടെ ഞാൻ ഈ വേദി പങ്കിടുകയാണ്. കഴിഞ്ഞ 19 വർഷങ്ങളായി അനേകം രോഗികൾക്ക് ആശ്വാസം പകരാൻ നമുക്കായിട്ടുണ്ട്. ഓരോ രോഗിയുടെയും ചികിത്സയും അതിലുള്ള ധൈര്യവും സഹനവും വിജയവും എനിക്ക് ആത്മപ്രചോദനവുമായിട്ടുണ്ട്. ഇവിടെ വരുന്ന ഓരോരുത്തർക്കും അഹല്യ ഒരത്ഭുതമാണ്, നമുക്കതൊരു വികാരവുമാണ്. ചെറുതും വലുതുമായ പല പല വഴികൾ, വിശാലമായ തടാകങ്ങൾ, വിവിധ ആശുപത്രികൾ, പല മേഖലയിലുള്ള വിദ്യാഭ്യാസ സ്ഥാപനങ്ങൾ, ആരാധനാലയങ്ങൾ, ഔഷധോദ്യാനങ്ങൾ, റോക്ക് ഗാർഡൻ, ഹെറിറ്റേജ് വില്ലേജ്, ശിലാശില്പങ്ങൾ, മെഡിസിൻ മാനുഫാക്ചറിംഗ് യൂണിറ്റ് എന്നിങ്ങനെ പൈതൃകവും പുരാതനവുമായ കാര്യങ്ങൾ ആധുനികതയുമായി സംഗമിക്കുന്ന ഒരിടമാണ് അഹല്യ. ഇവിടെ വരുന്ന ഓരോ രോഗിക്കും രോഗശമനത്തിനായി ഇതെല്ലാം ഒരു മുതൽക്കൂട്ടായി വരുന്നു. ഇക്കാലയളവിൽ നമ്മുടെ ഹോസ്പിറ്റൽ സേവനമനുഷ്ഠിച്ചിരുന്ന ഡോക്ടർ ആരതി മാം, ഡോക്ടർ രത്നാകരൻ സാർ, ഡോക്ടർ പ്രസന്ന മാം, ഡോക്ടർ വർമ്മ സാർ, ഡോക്ടർ സജീദ്, ഡോക്ടർ സുരേഖ എന്നിവരെയും ആദ്യകാല അഡ്മിനിസ്ട്രേറ്റർ ചാക്കോ സാറിനെയും സ്നേഹപൂർവ്വം ഈ അവസരത്തിൽ ഞാൻ കൃതജ്ഞതയോടെ ഓർമ്മിക്കുന്നു. കൂടാതെ ഒരു വേദി ഒരുക്കിത്തന്ന അഹല്യ മാനേജ്മെൻറ്റിനെയും ഏതു കാര്യത്തിനും കൂടെ നിന്ന് എല്ലാം സാധ്യമാക്കി തരുന്ന നമ്മുടെ പ്രിയപ്പെട്ട OM ശരത് സാറിനോടും ഈ അവസരത്തിൽ കടപ്പാടുകൾ അറിയിക്കുന്നു. ഞാൻ ദീർഘിപ്പിക്കുന്നില്ല. സംഗമം എന്ന ഈ കോൺക്ലേവിന് എല്ലാവിധ ആശംസകളും നേരുന്നതോടൊപ്പം അനേകം രോഗികൾക്കും ഇനിയും ആശ്വാസം പകരാൻ ഈശ്വരൻ നമുക്ക് കരുത്ത് നൽകട്ടെ എന്ന് പ്രാർത്ഥിച്ചുകൊണ്ട് ഞാൻ നിർത്തുന്നു. നന്ദി, നമസ്കാരം.
Thank you, sir. I invite Dr. Sunil Kumar, Vice Principal, Professor and HOD, Department of Kaya Chikitsa, Ahalia Ayurveda Medical College Hospital for the felicitation.
So good evening, everyone. Respected dignitaries sitting on the dais, our esteemed Chief Guest, Dr. J.S. Bhuvaneshwaran, sir, Director of PSG Hospitals, Director of Wellness, Dr. Ajesh Pilla, sir, Senior Consultant Kundavar, sir, Surya, sir, and Chief Medical Director, Dr. Suresh Baba, sir, a Principal, dear most colleagues, dear friends, and dear patients. I am honored to felicitate this function as we gather to celebrate 20 incredible years of service to our patients. Today we come together to cherish the memories, acknowledge the milestones, and reaffirm our commitment to the holistic healthcare. To our patients, we express our deepest gratitude for trusting us with your well-being, and your loyalty and support have been instrumental in our journey. To our dedicated team, your tireless efforts and compassion have made a significant difference in our countless lives. As we look ahead, we remain committed to providing exceptional Ayurvedic care and fostering and cultural wellness, embracing innovation and tradition. Thank you for your being part of our journey. Together, let us continue to nurture health, harmony, and hope. Thank you. Ahalia Future, Ahalia Ayurveda, the future of Ayurveda. Thank you, one and all.
Thank you, sir. I invite Dr. Swarochisha EV, Senior Consultant, Ahalia Ayurveda Medical College Hospital, for delivering vote of thanks.
Respected Chief Guest, dignitaries on the dais, distinguished guests, teachers, and my dear friends. Generally, it is assumed that Ayurveda is an ancient science, an outdated science, and it has gotten relevance to the modern world. But I would like to say that Ayurveda is more than a medical science, it includes physical science also. In Bhagavad Gita, the first chapter begins with a conversation between King Dhritarashtra and Sanjaya. Dhritarashtra says, he asks a question, Dharma kshetre kurukshetre samaveda yutsavaha mamakaha pandavascheva kim kurvadi Sanjaya. Oh Sanjaya, tell me what is happening in the land of in this holy land of Kurukshetra, where my children and the sons of Pandu are assembled. And Sanjaya replies, Drishtva tu Pandavanekam vyutam duryodhanasthatha acharyam upasamgamya raja vachanam abravit. Sanjaya replies, I see Drishtva tu Pandavanekam, I see the mighty forces of Pandavas, and I also see King Duryodhana approaching to Dronacharya, Acharya Upasamgamya, approaching to Dronacharya and telling something. Now this is a conversation happening in the palace. King Dhritarashtra is a blindfold Tata who's in the palace, and he's talking to his loyal minister, that is Sanjaya, and the conversation is taking place in the palace, and Sanjaya is giving, he's visualizing things in the battlefield. How could Sanjaya see across such a long distance? Interestingly, it is Sanjaya as the first news reporter in the history of news reporting. He gives a live report of the war zone without visiting the battle zone. How could Sanjaya see across such a long distance? No, forget about Sanjaya. Sanjaya belongs to yesteryears. Maybe he belongs to, it's a mythological facts or a fantasy. Let us assume like it, because nowadays it's a fashion to criticize our own religion. So we consider ourselves progressive when we criticize our own religion. Now let us come to the present history. In 1960s, there was a person called Ted Soros, Tedscrios. He had an ability to see images which are very far away. He can not only see images, he can also photograph those images. There are hundreds of photographs photographed by him. And there was a psychologist or a scientist called Jules Eisenbud, Juleisnbud. All this is in there in the net. If you see the Google, you can get all these facts. And he had compiled a book known as The World of Ted Soros, where he has compiled a lot of photographs taken by him. That is known as photography. So he can, sitting here, he can take an image what is happening in Taj Mahal. He has got that ability. Now, let me tell you another incident. There was a man called Emanuel Swedenborg. Now, Swedenborg was a scientist and a philosopher. In 1700, once he was taking a meal in his restaurant, he suddenly jumped out from the restaurant and started shouting, "Fire, fire." And everybody was, because the restaurant was very calm, there was no fire, and this person was coming outside of the restaurant and was shouting, "Fire, fire," and he was perspiring. So they asked him, the people around him asked him, "Sir, what's happening? What's wrong with you?" Then he said, "Hundreds of kilometers away, a village is on fire. Go and extinguish the fire." So immediately a horseman was sent, and it was later reported that it was informed that the whole village was on fire, and many people perished. Aryabhatta, sitting the banks of river Ganga, just looking at the open sky, could tell you the position of the planets and the movement of the stars. In our own Ayurvedic textbooks, with I mentioned number of Sira, Grandhi, Asti, Sandhi, Snayu, Marma, Sira, Kantra, and so on, the whole human anatomy and physiology is well explained. Even the embryology, the monthly development of the fetus in the womb of the mother is well explained. Masa Anumasa Garbhasya Vrtihi, Charga says, Vagbada says. There was no USG, MRI, CT scan in those days. How could they visualize all these things? All this is because of the internal energy, or called mental energy. What is energy? Energy means the capacity to do work. Energy can neither be created nor destroyed. It can only be generated from one form to another. This is the law of thermodynamics, law of conservation of energy. The first law of conservation of energy says that energy can neither be created nor destroyed. It can be transformed from one stage to another. This is exactly what Ayurveda says. This Ayurveda, we call energy as Prakriti. And Prakriti changes from one form to another. Prakriti to Mahat, intelligence, Ahangara, and mind. So in other words, we can say that mind is an energy. After Einstein, it is known that matter and energy are both one and the same. Matter is energy and energy is matter. So matter becomes energy and energy becomes matter. The atom bomb was developed according to this formula. The explosion of an atom bomb is a declaration that matter is converted to energy. One atom is split and becomes energy. The reverse is also possible. Modern physics has discovered that one of the greatest things, that matter is energy. That's the greatest contribution of Albert Einstein to humanity. E is equal to mc square. Matter is energy. Matter only appears. Otherwise, there's nothing as matter. Nothing is solid. Even a solid rock is pulsating energy. Matter has been found not to exist at all. This insight of matter brings modern physics very close to the teachings of Ayurveda. Eddington, one of the greatest scientists of this age, has said, "We used to think that matter is a thing. Matter is just like a thought. It is not that matter exists. It is just one who realizes matter, goes in between. It's an energy, and one who penetrates. The rishis have come to another conclusion, which science is yet to agree with. They have to agree one day. The rishi says, when you penetrate deep into energy, even energy disappears. What remains is consciousness, and that is the deepest core." So this is what I want to say, that Ayurveda is not only a medical science, it is more than a medical science, it is something, it is inclusive of physical science also. With this, I come back to my assignment, my official duty. First of all, I would like to thank Dr. Bhuvaneshwar Swar, Director of PSG Hospital, for spending your valuable time with us. We understand the value of time. Sir, time is also a dimension of space. And I thank you for giving priority to participate in this program. Thank you, sir, for coming here. I thank our Chief Medical Director, Dr. Suresh, sir, for participating in this function. Thank you, sir, for spending a precious time with us. I thank Dr. Ajesh sir, Director of Ahalia Wellness. Sir, it is because of your dedication and service Ahalia Ayurveda has attained its present glory. You are a source of inspiration to the generation of next doctors. Thank you, sir. I thank Principal Dr. Shaba Madam for all her support and cooperation to make this event a grand success. I thank our senior doctor, Ahmad sir, Vice Principal Sunil sir, for devoting your time to attend this function. My special thanks to all the distinguished guests who have assembled here, thanking all the guests for spending your time with us in this Sunday evening. I thank all doctors, house surgeons, supporting staffs, administration staffs, housekeeping staffs, maintenance staffs, IT people, and all those staffs who have worked tirelessly for the last few days to organize this function. My sincere thanks to Administrator Shibu sir for wonderfully coordinating and conducting this program. Thank you, sir, for your dedication and involvement. And last but not the least, I thank our operation manager, Sharath sir, for guiding us and giving advices to organize this program. Thank you, sir. Thanking you all, and God bless you all.
Thank you, sir. With that, we come to the end of our inaugural ceremony and are moving on to the seminar session. Department, Ahalia Ayurveda Medical College and Hospitals, Palakkad. He completed his undergraduate studies at SDM Hassan and post-graduation from SVM College Ilkal, followed by a CRAV specialization in ophthalmology at the National Academy of Ayurveda, Ituli Ayurveda Hospital. With years of clinical and teaching experience, he specializes in the Ayurvedic management of eye and ENT disorders. His passion for research and innovation is reflected in his impressive body of work. He has presented award-winning papers at various national and international conferences, authored a monograph on diabetic retinopathy, and published multiple research articles in his field. Please join me in welcoming Dr. Yadhukrishnan as he takes the stage to share his valuable insights with us today. We welcome you, sir.
Hello.
Good evening all. So I would like to present a session on the topic Shalakya Tantra in Ayurveda. So why this topic? Because this topic comes from the question that is there any treatment in Ayurveda for eye and ENT ailments? So from that only this question is coming. So there comes the answer Shalakya Tantra. What is Shalakya Tantra? Shalakya Tantra in our ancient text, our Charaka and other Acharyas told that Shalakya Tantra Nama Urdu Chaturgadanam Yoganam Sravana, Nayana, Vadana, Ghanadi Samsridanam, Vyadhinam, Upashamanartham. So that means it explains everything about the treatments of eye and ENT. So Shalakya Tantra explains all the treatment about eye disorders, ENT disorders, orodontal diseases, and head diseases. So we can treat all the treatments of the Ayurveda. The Shalakya Tantra includes all the treatments of these all ailments. So how we can treat these all things? With the modern equipments and the modern investigative parameters, we come to the diagnosis and investigations. Through that, we are coming to the diseases, which all diseases is having through these equipments. Then we can go to what all the treatments are there in Ayurveda for this Shalakya Tantra. There comes all the treatment methods in Ayurveda. So you may be all will be familiar with these figures, which shows, the first figure shows the Tarpana, second figure shows the Puttapaga. Okay, in the first figure you can see that the eye is filled with the medicated ghee. So the Tarpana procedure means we are instilling the eye with the medicated ghee for a stipulated period of time with the help of Masha. But in the procedure of Puttapaga, we are not using the ghee. In place of that, we are taking the juice of the Malsya, Mamsa and medicated plants in a special way that is called the Puttapaga method. Through that, we are taking the extract and we are doing this procedure. So that is called the Puttapaga. Next, what you are seeing, first figure, you are seeing that, the Bidalagam. In Bidalagam, we are making a paste, a soft paste of medications and applied over the eyes except the eyelashes and eyebrows. That is called the Bidalagam. And next treatment, what you are seeing, the Pindi, it is almost like the iPad only. In that, we are making the medicated paste and applied over a wick or a gauze piece and applied over the eyes. But in this procedure, we are covering eyelashes and eyebrows also. That is the difference between these two. Next, what we are seeing, the Aschodanam. For Aschodanam, we are making the arkas or special medicated ghee for the Aschodana procedure. It is almost like the modern eye drops only. So we are instilling these eye drops into the eyes. That is called the Aschodanam. And next, what you are seeing, the Anjana. What is Anjana? In Anjana, we are making a Varti. Varti means it is like a small tablet only. That tablets we are made and it is pasted with the help of different types of sorasas. That sorasas is according to the condition of the eye. And making this paste, we are with the help of, you can see one rod in the figure. So according to the condition, we are taking different type of shalagas, that rod. With that rod only, we are applying this medication into the eyes. That procedure is called Anjana. Next, this is called Netra Dhara. Actually, we have conducted different Netra Dhara camps around our campus to make awareness about this procedure. Because this is a wonderful procedure what we are doing in Ayurveda. In this, we are instilling the medicated kashaya over the eyes, just like eye washing. You can see in this figure. So, we are making this kashaya according to the eye condition. Maybe the eye will be having Vata dominant condition, Pitta dominant condition. You all knowing about these doshas and all. So according to the doshas, we will be making the specific kashaya, and with that kashaya, we will be doing this segam procedure. That is called Netra Segam. Next, what you are seeing, this is Lekhana. In Lekhana, while seeing the figure, it may be horrifying, and you will be feeling that it is making so much pain and all. But not like that. It will be making some hurt, but it is very much effective in different types of eye ailments, like follicular conjunctivitis and all. So in that, we are scraping the palpebral conjunctival area with plant-based origin equipments or another equipments. That procedure is called the Lekhana therapy. Next, what you are seeing, the Jalauga. This Jalauga, you may be seen that doing in different types of skin diseases and all. Simply, it is called the leech procedure. So that also we can do in the eye with the small types of leech, which is called, we call Nulatta, like in Malayalam. With that only we are doing this procedure. So it is also very effective in different types of eye disorders, especially in glaucoma also. So all together, what I have shown includes these all procedures. This all is together is called Netra Kriya Kalpas. So these procedures are done in Shalakya for Netra Kriyas or Netra disorders. So in what all condition we can do this all procedure? Here comes the answer. We can do that in any type of infections like condition. It can be because of bacteria, virus, or fungus, and and other disorders like age-related conditions. It can be diabetic retinopathy or age-related macular degenerations conditions, or in eye it can be glaucoma, or it can be occupational disorder. For example, computer vision syndrome, dry eye. In all these aspects, we can select any of the above selected Netra Kriya Kalpas, and we can do that. Next, is there only Netra Kriya Kalpas in Shalakya? No. We are having other Kriya Kalpas which is effective for other ENT disorders also. Here comes the other Kriya Kalpas. That includes especially the Karnapurnam, what you are seeing in the third figure. It's Karnapurnam. What is Karnapurnam? In Karnapurnam, we are filling the ear with medicated oil for a stipulated period of time. In that, we are having one pre-procedure is there, a main procedure is there, and post-procedure is there. But the main procedure includes the filling of ear canal with the medicated oil. So this is very much effective in different types of ear disorders like age-related deafness, hearing loss, sensory neural hearing loss, or tinnitus. You may be heard that there's ringing sound in ear while going old age. That time also we can do this simple procedure and can cure that. Next, what you are seeing is the Gandosham, Kavalam. These all procedures are also effective for the orodental diseases. Next, what you are seeing is the Kanna Dhupanam procedure. This is a beautiful procedure. In this, we are making a wick, a varti with a medicated paste, and with that we are making a medicated fumes. These fumes we are given to the ear canal. Actually, for the ear disorders, we used to do that. In the figure, you can see that with the Dhuma Netra, we are giving that medicated fumes into the ear. So this is also very effective in many other ailments of ear. So, with what medications we can do these all things? For example, in Ayurveda, there are specific medications which is told for the Shalakya ailments. So, we are preparing that all medications and doing these all procedures. Okay. So, I want to show you some of the articles we have published in the journals, national journals, what we have got the results. So, these are some of the articles about the eye disorders. This is one of the article about ptosis. Ptosis is a condition. You can see in the first figure, there is a drooping of eyelid. In the right eye of the patient is drooping of eyelid is there. So after our treatment, it was improved, almost 80% improvement is there. So we have published this in an article. You can search in online also with our institution name. So you can see that. So this is the improvement what we have got in the ptosis condition. Another condition, what I am showing, this is a condition of diabetic retinopathy. In the first figure, what you are seeing, the OCT of diabetic retinopathy, in that there is severe edema is there. But while seeing the after treatment, in the next figure, you can see the OCT, the edema is reduced. So that was the result what we have got. Next, I am going to some of the ENT disorders. Here I am showing the tympanic membrane perforation. This is very common condition. Due to trauma or any other condition, there will be perforation. That means hole in the ear. Hole in the, means the tympanic membrane. Tympanic membrane is the structure which is very much helpful for the hearing. So when there is a hole in the ear, you can see this USD camera figure, what you are seeing in the first image. So I have marked that. That is almost about 50% hole is there in the tympanic membrane. That is almost healed after our Ayurvedic treatment. It was healed completely. The tympanic membrane was perfect after the treatment. So this is not the last. We need some more researchers and we need some more treatment researchers in the field of Shalakya. So we are on the movement of that. We are trying for the level best for that. So with this session, I hope everyone got to understand something about our Ayurveda, our Shalakya Tantra in Ayurveda. And thank you for all patient listening. Thank you everyone. Thank you very much.
Thank you, sir, for being with us today. Your presence and insightful presentation truly elevated our event today. We are so grateful for your contribution, sir. For the kind attention of our guest, if you're having any queries or confusions related to this topic, you can write it on a piece of paper and our volunteers would be collecting it. After end of all the sessions, we will be having a doubt clearing session and your doubts will be cleared then. Next session is on the topic Sudhika Parichariya in Ayurveda, conducted by Dr. Reshma K.T., Senior Consultant, Ahalia Ayurveda Medical College Hospital. Dr. Reshma K.T. is a dedicated Ayurvedic physician who completed her BAMS from VPSV Ayurveda College, Kottakkal. Since joining Ahalia in 2007 as a resident medical officer, she has served the institution for over 18 years with unwavering commitment. Her clinical expertise lies particularly in the management of gynecological disorders, including infertility. In addition to her extensive clinical work, she has organized several medical camps and health awareness programs within and beyond the campus. She has recently launched a cosmetology clinic as a new venture, blending traditional Ayurvedic wisdom with modern skincare. With much pleasure, we invite you, ma'am, for taking this session. Ma'am, please.
Thank you. Good evening, everybody. Good evening. I am going to have a very short session on Sudhika Parichariya, that is postnatal care according to Ayurveda at our Ahalia Wellness Center. Ayurveda emphasizes Sudhika Parichariya, that is the care of the mother after childbirth. Postnatal period of 45 days, we focus on restoration, rejuvenation, and balance of the body. Aim. A woman who has delivered a child is called a Sudhika. Postnatal period is crucial for her long-term health. Restoring her Agni, that is appetite, correcting dosha imbalance of the body, mainly Vata dosha, and promoting lactation and mental well-being. Ayurvedic principles of postnatal care. Vata dosha increases after delivery and it must be corrected. Restoration of digestive fire, that is Agni. Strengthening dhadus, that is tissues of the body. Promoting stanya janana, that is lactation. Balancing physical and mental health. Ayurvedic diet for the postnatal mother. Easily digestible, warm and vata pacifying foods. Initial days with rice gruel, that is kanji with ghee and some medicines like panchakola churna. Gradual addition of cooked foods, that is cooked vegetables, pulses and milk. Adequate hydration, and better to avoid cold, dry, heavy, spicy and fermented foods. The medicines and herbs we give to the Sudhika. Herbs that is good for the mother is Ashwagandha, which is strength and rejuvenating the mother. Shadavari, Guduchi, Trigadu, Vidari, etc. And the medicines we offer them, Dhanandaram Kashayam, Jeeragarishtam, Dashamoolarishtam, Shadavari Gulam, Vidarya Lehyam. Therapies we give to the Sudhika. Abhyanga, that is oil massage. We give daily massage with special oils like Dhanandaram Thailam that can reduce the fatigue, improves the circulation, calms the vata. Sega and Swedana, that is hot fermentation, that is for pain relief and detoxification, and we give medicated bath. Lifestyle, complete physical and mental rest for 6 weeks. Better to avoid heavy work, travel, and emotional stress. Warm, calm, and clean environment. support from family and community. Modern relevance of Ayurvedic postnatal care. Integrative approach, combining Ayurveda with modern obstetrics, effective in reducing postmortem depression, fatigue, and infections, promotes holistic recovery and bonding. Our hospital facilities. We provide all these facilities in our premium lake houses and cottages for however many days the patient wishes to stay. With 24/7 days, doctors and nurses on duty will be available. Thank you. Thank you.
Thank you, ma'am. We now have an interesting quiz segment. For that, I invite Dr. Arya S. Verma, Professor and HOD, Department of R&B, Ahalia Ayurveda Medical College and Hospital, Palakkad.
A very warm good evening to one and all gathered here. Welcome to Sangamam. So adopting Ayurveda in your life is one of the best gifts that you can give to your body. Today, I want to take a moment to appreciate for the wise decision you have made to adopt Ayurveda in your personal health care. And thank you for experiencing it through Ahalia Ayurveda. Now we have a fun quiz session. Only patients can participate in this. And I wholeheartedly welcome all of you to participate. And yes, of course, there are some exciting prizes for the correct answers. Let's begin the quiz session.
கவனத்திற்கு இப்போட்டி விருந்தினர்களுக்கு மட்டுமே.
Session is exclusively and only for our guests. House agents and doctors are not requested to participate in it. Question number 1. Which organ is responsible for pumping blood throughout the body? I repeat, which organ is responsible for pumping blood throughout the body? Option A, brain. Option B, liver. Option C, heart. And option D, kidney. Answer is right. I invite Dr. Sheba Sunil, Principal, Ahalia Ayurveda Medical College, to hand over the gift. Thank you, ma'am. Question number 2. Where does digestion begin in the human body? I repeat, where does digestion begin in the human body?
கேள்வி 2. மனித உடலில் செரிமானம் எங்கு தொடங்குகிறது?
Options. Option A, stomach. Option B, small intestine. Option C, mouth. Option D, esophagus. Answer is mouth, and the answer was right. So answer was right. Mouth, because food should be chewed properly before swallowing, and there comes the importance of mindful eating as per appetite. So I request Dr. Jyoti Sajain, Associate Professor, Department of Agadadandra, for handovering the gift. Since there is an issue with the PPT, we'll be connecting it very soon. Next question will be projected in the PPT, and there's some technical issues, so we are arranging it shortly. Question number 3. Which organ removes waste and excess water from the blood? I repeat, which organ removes waste and excess water from the blood?
It's kidney.
Okay, kidney, it's the right answer. I invite Dr. Yedu Krishnan, Department of Shalakya Tantra, for giving over the prize. I also invite the prize winner to receive the prize. Thank you, sir. Question number 4. Which hormone regulates blood sugar level? Option A, adrenaline. Option B, insulin. Option C, thyroxine. And option D, testosterone.
Insulin. Insulin.
Insulin is the right answer. I invite Dr. Arya ma'am, Professor and HOD, Department of R&B, for giving over the prize. Question number 5. Which vitamin is produced by the skin when exposed to sunlight?
It's vitamin
Vitamin
D.
A,
It is the answer is D, vitamin D.
okay, vitamin D is the correct answer. I invite Dr. Sumina ma'am, Senior Consultant, Ahalia Ayurveda Medical College, for giving away the prizes.
Round 2, it's about diseases and treatment. Question number 1. Is thyroid disease seen only in women? Option A, yes, only women get thyroid problems. B, no, men can also have thyroid disorders. C, it depends on age only. And D, only children get thyroid.
It's B. B. It's B.
D is not the right answer. B. Yes. Yes, B is the right answer. I invite Dr. Anup Kumar CA, Professor and HOD, Department of Panchakarma, to give away the prize. B. B ആണോ പറഞ്ഞേ? അവരെന്നെയാണോ പറഞ്ഞേ? Okay, sir, please come. Question number 4. Chronic lack of sleep can lead to A. Increased memory, B. Reduced immunity and increased disease risk, C. Improved focus, D. Slower metabolism.
The answer is B.
Answer is
B. B.
B. Right answer. Please come to the stage. I invite Dr. Srinath to give away the prize. Question number 5. How much should a person exercise as per Ayurvedic rule? A. Till you are exhausted. B. When you are sweating heavily and breathing hard. C. Until half of your physical capacity is used. D. Up to the body starts aching.
C.
Yes, correct answer. Ma'am, please come to the stage. I invite Dr. Reshma to give away the prize. Thank you, ma'am. Thank you. Thank you for actively participating in the quiz session. Thank you.
Thank you, ma'am, for conducting this session. Next seminar session is on stress, conducted by Dr. Sumina, Senior Consultant, Ahalia Ayurveda Medical College Hospital. Dr. Sumina is a dedicated and compassionate Ayurvedic physician with a strong foundation in both traditional healing and modern psychological understanding. She completed her BAMS from KVG Ayurveda Medical College and Hospital, Karnataka. To expand her holistic approach to patient care, she pursued a master's degree in psychology from Bharatiyar University. Over the years, Dr. Sumina has conducted numerous health awareness sessions and wellness talks within and beyond the campus. Her ability to connect with people and simplify complex health concepts has made her sessions both impactful and widely appreciated. With much pleasure and gratitude, we welcome you, ma'am, for this session.
Good evening, everyone. It's my pleasure to be here with you in this evening. And first of all, I would like to thank you all for trusting us, because without a healthy and happy patient, a doctor cannot be successful. So once more, I would like to thank you all for joining with us in this evening. Okay, in the few minutes, I would like to discuss you something about that we all face in our day-to-day life. It's none other than stress. Actually, what is stress? It's sometimes a weightage of our worries. Or sometimes we can say it's a burden of our uncertainties. Or sometimes we can say it's our capacity, or sometimes our resilient capacity is exceeding, that is giving a pressure over us. So altogether we can say stress is a protective mechanism actually. So in this coming sessions, we'll like to have a light glimpse into how stress, how it is affecting your behavior, emotions, and how you can manage effectively in your own basis. Okay, shall we move? Okay, actually stress is a protective mechanism which is helping us to be bit more alert, and actively we can engage the incident. So it is a fight or flight response. So we can help, this is our survival mechanism. So previously, whenever you are facing a tiger or something in ancient days, we are having a alert mode. So after some times, we are coming out of the alert mode and we will be cool. So it is not like that in our present time. So we are having lot of pressure, maybe due to family, maybe due to profession, or lot of reasons are there for making us to be stressed. So we need to come out of that in a day-to-day basis. Otherwise, it is moving into a chronic stage where it creates problems. Otherwise, in a normal life, stress is only a protective mechanism which keep you vigilant, and you can face the situation bit more vigilantly. Okay, so shall we look into the symptoms of stress? So stress is normally affecting your physical symptoms, mentally and behaviorally, both ways. All the three ways it is affecting. So physically you can see the symptoms like headache, your muscles are getting too much tensed, and you are having a fatigue feeling. From the morning onwards, you feel like you are too much tired, you don't have any interest into engaging any activities, and you feel like you just want to lie down as it is. So it is the main system. Along with it is affecting with digestion process, because vagus nerve is directly having a connection with the stress, so it is affecting your digestion also, and automatically if you are managing it in a proper way, it will elevating your blood pressure and leading to some other complications. So coming to the mental aspects, it will give you a lot of anxiety. What is anxiety? It's an irrational fear. You don't know. Something is there. You are feeling like a heaviness, and you don't know for what reason your heart is beating like anything. With palpitation, you always have a anxiety. So you are always in a irritated mood. We cannot keep cool as it is. Sometimes we don't know for what reason we are irritating. So it may be due to stress. So you cannot, after that, you cannot concentrate in anything. Even if you are doing something, you are watching a movie, or you are going with your friends, but you cannot sit cool. That is also a reason. Maybe stress, look into that aspect. And some people are coming and telling us that, doctor, we cannot memorize everything. I'm easily forgetting everything. Sometimes I'm going for purchase anything, but I'll forget and come back. I don't know what reason. There may be a chance for stress. Please look into that aspect also. And persistent low-level mood. Here, many of the cases like anxiety disorders, depression, bipolar, main starting is from the stress area. If you are not managing your stress in a proper way, that may lead into some symptoms in future like anxiety disorders, depression, so and so. So coming to behavioral changes, you can see a lot of sleep issues. You cannot sleep properly because melatonin is a chemical which induces sleep. When our stress hormone cortisol is in a high, this chemical cannot work properly, so definitely you are always in a disturbed sleep. So your appetite, next is altered appetite. And next is, appetite means we don't have a proper hunger. Normally we are having a good feel when you are going out with friends and that strong aroma in the hotels or restaurants. We are getting a nice feel. But even sometimes we don't feel like eating something. That may be due to stress. Please have a look. And next symptom is social withdrawal. Previously you are enjoying with, whenever you are going for a marriage or a party, you are enjoying, but sometimes we cannot enjoy. That may be also due to stress. Please look into. And increased alcohol intake. Many people are considering alcohol intake as a escapism from the stress. Once if you started the habit, it's very difficult for you to control, and that is persisting, and in future you may be addicted to such symptoms. So please have a look into the symptoms. If it is there, here I am just narrating a few points which may be a symptom. So whenever you are facing such incidents, please try to control it. So what we need to do if we are having such symptoms? So first is cultivate self-awareness. So how you are cultivating self-awareness? Learn to identify your unique early warning signs of stress. As we said earlier, we told some physical, mental and behavioral symptoms. If you are having some warning signs, please have a look into your stress aspect. So then perform a body scanning. Notice your physical tension, like your muscles are get tensed, clenched jaws. Your heart is beating so fast, it is palpitation, and shallow breathing, that is as a symptom of palpitation, some gasping like feeling here. Normally our breathing or ventilation is easy process. We are doing a labored breathing. But if you are having a problem for breathing, please look into your stress aspect also. So then do a emotional check. Are you experiencing persistent worry, feeling overwhelmed, or having sudden mood swings? Please check your stress levels. So then you look into your behavioral patterns. First one is procrastination. What is procrastination? It's none other than postponing your day-to-day activities into next day. Next, increased caffeine intake. Also, alcohol also will come under that, or restless night also. As we said earlier, this just first you recognize your stress, then just scan yourself for the symptoms, then you need to do a next level for controlling that. So it is a practical coping strategies, your mind and emotions. First in the first stage, we told some symptoms. Next, we did ourselves a scanning. In the next slide, we are moving into coping strategies. And the first is mindfulness practice. I think Dr. Farshad will explain you next session. And mindfulness and relaxation technique, here I'm not going to explain, because again you will get another small session. You should do a cognitive reframing. That is what we are doing in counseling practice. The way I'm perceiving a situation is different. It's from my own perception, and your point of view may be different. So what we need to analyze the situation in another angle. Just maybe my observation may not be correct. So we need to think from another person's perspective, and we need to correct ourselves what are the lacunas. For that, this journaling for clarity will help you. You just note it down. how this stress is coming, from where you are getting the stress. Maybe my observation, my behavior, my anger outburst, my way of time management, my emotional problems, my interpersonal relationship issues, my decision making problems. So first you understand where you are lacking. So if you are journaling, it's easy for you to identify from where this stress is originating. So it's very easy for us to control ourselves. So in a practical life, what we can do is regular exercise. A regular 30-minute gentle walk itself will create a lot of dopamine. So you'll get a state of well-being, and that will help you to manage the stress in an optimal level in a normal case. So next one is the balanced diet. Our diet is having a main role in the stress, and definitely you should have a look. High spicy and high caffeine containing foods will definitely improve your stress level. So please have a look into your diet. And next, quality sleep. Normally our habits are, we'll eat very night and we'll chit chat, we'll watch movie and we'll have a late night sleep. Morning, but we need to get up early morning, we need to go for a job. So our sleeping times were reduced. Please have a look into that, and definitely you should have a at least 7 to 9 not means at least just 6 hours sleep is mandatory for everyone for a healthy life. Then last point is very important, social connection. Spending time with supportive friends and family can reduce cortisol levels, our stress hormone levels by 20%. Whenever we are having a gathering like this with our dear and near ones, our stress levels are coming down, our cortisol hormones are coming down, so that your endorphins, dopamines and serotonins are, these are happy hormones that is secreted into your body, so that we will get a state of well-being and will get a happy and pleasant feel. So that our energy level will be normal, our immune system will work properly, so that we can have a normal stress-free life. Okay, so here one more point I'm adding, when you need to seek a professional help. These are the points you can look into yourself and you can have a self-manage. So I just want to tell you that when you need to come and meet us, so it is if the symptoms are persistent, you cannot manage yourself, your daily activities for several weeks, definitely you should come and meet a professional. Okay, so whenever you, sometimes we feel, no, I'm always forgetting everything, I'm a little bit more agitated, I'm a bit more angry with everyone, so you cannot sleep, you cannot eat properly, you cannot enjoy the previous activities what you have enjoyed before. So in such cases, if it is persisting more than 2 weeks, definitely you should consult a professional. Then if you feel that overwhelming your feelings, experience an inability to cope, constant anxiety or frequent panic attack. So many times the panic attack may be, we may think it as a heart attack, or shallow breathing is sometimes misunderstood in some other ways. So control your stress level and cortisol level properly. And you always, whenever you feel a harmful thought, like if you have a thought of self-harm or harming others, you need to seek immediate help. Okay, so we just go through a behavioral, mental, emotional symptoms, the main strategies, how it is affecting. Just look into the daily activities which will reduce stress, and when to seek a professional help. So just I want to tell that stress is a manageable condition. Early awareness and action are crucial for effective stress management. You just have an aware what makes you stress, the triggering factors. Please have a look into that and just manage it. So second, prioritize self-care. Your health is invaluable. Make self-care a non-negotiable daily priority. We are always giving priority for our kids, husband, our job, everything. But we are not giving priority to ourselves. Give priority to yourself and look into your stress symptoms. You can bring small changes, but it can give a big impact. Consistent increment. So whenever you are little bit adjusting your daily routines, definitely you will get a big impact in your emotional, personal happiness index. So seek support whenever you feel like you are overwhelming with your symptoms. Daily, നിങ്ങൾ മടിക്കേണ്ട ആവശ്യമില്ല. പലപ്പോഴും പലർക്കും മടിയാണ്. Whenever you feel like how other people will think, what other people will think about you. Please don't think like that. You are here. Mental illness are starting with the stress. So we need to control from the beginning itself. So control yourself and have a healthy and happy life. We only have a single life. And we need to find our happiness. We need to control our stress level. Stress is the first and small thing which makes you unhappy. So try to be happy with our own activities, our own way of thinking, our own problem solving mechanisms. Okay? Anybody is having any doubt? I'm just running with the time period. So I know that I'm a bit fast. If you want to clarify me in any of the areas, it's my pleasure. No? Okay, so I'm winding up here. Okay, thank you.
Thank you, ma'am. Moving on to the next session, I take immense pleasure in introducing Dr. Srinath P.S., Assistant Professor in the Department of Shalya Tantra, Ahalia Ayurveda Medical College and Hospital, Palakkad. With profound dedication to the field of Ayurvedic surgery, Dr. Srinath P.S. serves as a highly skilled Ayurvedic surgeon and academician whose expertise spans over multiple areas. He is a master of anorectal surgeries, proficient in both traditional Ayurvedic techniques and modern advancements for conditions like hemorrhoids and fistulas. Beyond that, his knowledge extends to Ayurvedic orthopedics, focusing on the management of musculoskeletal disorders as well as the specialized healing art of marma therapy. Without further ado, I extend a hearty welcome to Dr. Srinath P.S. to take over the sir. Welcome, sir.
Thank you. A warm good evening to one and all. First of all, I'm extending my thanks for all the patients who have come across from Coimbatore and other parts of Tamil Nadu. My presentation is mainly based on the Shalya Tantra department, that is the surgery department of Ayurveda. And most of the patients may be thinking what we can do in a surgical disease or surgical things. I mean, the procedures, what we do. Most of the people will be thinking surgery is only related to allopathy practice. But actually in our Indian science, like it's already been told before many years. The father of surgery or the father of plastic surgery is considered as Susruta Acharya, which is our Acharya. We are following that. Shalya Tantra is mainly based on the principles of Susruta Acharya. Okay. So here in our hospital, we are dealing with many kind of anorectal diseases. You may be knowing like piles, fistula, fissure, like that. So I will be giving you a brief glimpse of what we are doing in our hospital. So in this slide, you can see the picture of Susruta Acharya doing the first surgery, which is rhinoplasty. He was doing rhinoplasty in olden days. At that time, we were using this kind of anesthesia with foods like that. We will be giving food items like madhya and all to the patient so that he will feel little bit intoxicated with this, so he can tolerate the pain. So this is a picture of rhinoplasty procedure done by Susruta. This is a crude form of surgery which was far developed nowadays. So this is the basics of surgery, development of surgery in Ayurveda. That is by Susruta Acharya we are following the principles of surgeries, and Susruta already mentioned in Susruta Samhita, the Acharya already mentioned about the shastras, the instruments what we are using now. The crude form was already been told, which was again modified, and now we are using all those instruments which are used in the modern surgical practice. And along with that, Susruta already mentioned around 120 procedures, like the surgical procedures. And it is a blend of precision, compassion, and with a holistic care we deal the patients in Ahalia Ayurveda Medical College and Hospital. So here we are blending the ancient science with our modern practices, and we are seeing the patient as in a holistic manner, not only just the disease. We are more focused on their mind and body to heal together. Okay, so our department, like the Shalya Tantra department, mainly deals with Shalya means it's an obstruction or foreign body which causes disease. So in our department we are mainly focusing on removing this foreign body from the body, and restoring the balance. So here we are emphasizing on the pre-operative and post-operative care and use of herbal medicines and other rasayana drugs to repair the body and help to restore the normal health as fast as possible. And along with that, rejuvenation also we are doing here. Okay, so this is the core of this presentation. What all procedures we are doing in our hospital. Okay, mainly we are dealing with the anorectal diseases, that is piles, fistula, fissure, and all. So in this we are dealing with Shara Sutra. In piles and all we are using Shara Sutra, and fistula also done using Shara Sutra. Shara Sutra means it's a plain thread which is medicated thread. 21 times we are coating it with medicines, Ayurveda medicines, and in this there is slow cutting and slow healing is happening. What happens when you go to a modern hospital is they have this fistulotomy procedure. That is, I think most of the patients, some may be knowing, fistulotomy they are cutting and opening these tissues. So the chances of recurrence is more in such kind of procedures. So in our hospital, using this Shara Sutra, there is slow cutting and slow healing is happening. So the recurrence rate is almost minimal, very minimal, like we can reduce to almost 5%. 5% recurrence we can expect, but which is treating a fistula is very difficult thing. And here we use this Shara Sutra so that it can be easily managed. The time constraints will be there, but we can assure you like 95% there will not be any recurrence. Next treatment procedure is while dealing with this anorectal disease, most of the people won't be coming to the OPD. I mean, most of the patients will be having this kind of diseases like constipation, like bleeding per rectum. But most of the people won't come to the doctors. They will neglect this disease and they will move on with this, live with this disease, and it becomes a chronic one, which will be a little more difficult to treat. But if you come to the OP in the initial stage, we can diagnose. I mean, we doctors will be looking, we have a team of doctors in our department, like almost 4 surgeons are there. So we will be doing the surgeries in a teamwork. So it starts with initially one examination will be there. Everybody have inhibitions of their own, but I am saying that if you have any small problem or small difficulty, first you come to us and get an examination done. That is a per-rectal examination. It won't be painful. It is a very simple thing. You can come and get the examination done so that you can diagnose the disease. Whether it's a fistula, whether it's a hemorrhoids, maybe it may be a small disease like fissure. But the people think that it may be piles or big cancer, like that people may think. But you should come and do the examination and get it diagnosed first. And if it is in the initial stage, we can reduce it with, completely we can reduce it with medicines, like herbal medicines, like Ayurveda medicines. But if you don't come at the proper time, what happens is this disease may progress to a chronic one. Then it will end up in a surgical procedure. So that is the basics of anorectal diseases. And the next topic is chronic wounds, like Dushtavrana Vise, that is diabetic ulcers, diabetic wounds. Here it needs proper care, proper examination and proper debridement of the wound and all. So in our hospital we have an OT, a well set OT, where we do all these procedures, and we have minor OTs also, where we do the debridement of these kind of wounds. So under proper supervision of our team, we will be doing this kind of proper cleaning and dressing of the wounds, which will help in further healing of the wounds. Sometimes what happens means there will be a small wound and the patients will not be cleaning it properly. Debris is something that hampers the healing. So only a qualified doctor or qualified surgeon can identify this debris and cut it using scissors and our instruments. And after cutting this, there will be proper healing of these wounds. Otherwise, you will be cleaning daily at your home with betadine or whatever you have. You will be cleaning and you will be saying that it is not healing. So it needs proper medical attention. Only then it will be healed properly. And next one is joint disorders. In that, mainly we use Agni Karma. Agni Karma is giving heat therapy using an instrument. That is mainly used for calcaneal spurs and bursitis and sciatica. Most of the people will be having that pain on the heels. So we can reduce it with a sitting, 1 or 2 sittings of this Agni Karma, which is done using a specialized instrument. Within a gap of 1 week or 2 weeks, you can come to our hospital and get diagnosed, whether it's calcaneal spur or anything. Then if the doctor feels it should be given an Agni Karma, then it will be referred to our department and we will be doing this Agni Karma. It gives sudden result of, there will be absence of pain after this procedure. The next main thing is varicose veins. Most of the people will be having these varicose veins in their starting stage or in the second stage or third stage or the fourth stage, which obviously have a ulcer, venous ulcer over that area. That is the fourth stage. So we are getting all these grades of patients in our OPDs. Initially, actually, one myth is there is varicose veins can be cured or not. It cannot be cured completely. You can modify it, you can change your lifestyle and you can cope up with that disease, and symptom-wise you will get good results. Once the veins are damaged means it's damaged. The valvular damage causes these varicose veins. So initially if you are coming to the OPD, you can prevent that disease to become a chronic or next stage. You can prevent the disease to go for a next stage. So if it is in the grade 1, if you are taking proper care, it won't go to the grade 2. So that is the treatment of varicose veins. So we will be assessing, by clinical examination, we will be assessing in which grade it is, and if it is required, we will go for a venous Doppler. So here we are incorporating our Ayurveda science along with the modern investigation techniques and we will be finding in which stage you are having these varicose veins. And next we will be giving, if it is minimal, you can get rid of the symptoms by taking a course of medicine like kashayas, aristas and all. And if it needs to go for a, little bit complicated, means we will ask the patient to take IP admission, like treatments like Abhyanga and all, purificatory therapies will be there. So that is the management of varicose veins. In varicose veins, we can administer this leech therapy, which most of the people have a doubt whether this leech is poisonous or not. We are using medicinal leech, Hirido medicinalis, that is medicinal leech we are using. That is being used only after a proper blood investigations. Like we will be doing all the basic blood investigations to get rid, check whether the patient is not having any communicable diseases. So once it is done, means after making sure that it is not, the patient is not having any communicable diseases, we are applying this leech, that is medicinal leech. You won't be getting any pain. It takes around 40 minutes for the procedure, and it has a wonderful effect on the body, this leech therapy. Nowadays, in modern hospitals, like in plastic surgery also, doctors are using this leech. But these have been already told years before in our science. So we are using this, we are the first one to use this leech therapy for humans. And also for animals also, it is told in the text. So this leech therapy, after doing this leech therapy, the symptoms will be vanishing. Like if the patient is having itching over the legs, with one sitting and all, you will get tremendous results. And in case of thrombosed hemorrhoids, sometimes the patient will be having hemorrhoids. He is unable to sit in the chair. After one sitting of leech therapy over that thrombosed hemorrhoids, almost 50 to 60% of the pain is reduced. So this leech saliva is having almost 4,000 bioactive substances which are producing this kind of effects on the body. And we have another parasurgical procedures. I will be showing you some pictures. This is a picture of Siraveda or bloodletting therapy, which is commonly used in varicose veins. If the veins are engorged, we can go for this kind of practices, that is removing blood from that particular area after proper examinations. This is a picture of Agni Karma, which is used in case of plantar fasciitis, like heel pain. It can be used in any pain conditions like tennis elbow, golfer's elbow, sciatica, lumbago, all kinds of conditions where pain is a main problem. We can use this Agni Karma. Then another mode of bloodletting is cupping therapy. Otherwise, most commonly in the UAE, hijama therapy, they are telling us hijama therapy. The same thing is cupping, like wet cupping is there, dry cupping is there. That comes under the parasurgical procedures. This is a picture of leech therapy. It may be looking awkward, but it has wonderful results. It won't create much problem. Only thing is you have to take a blood investigation before doing this procedure. It's a very safe procedure and effective too. This is a picture of corn, like in Malayalam or Tamil, Ani. Many patients are suffering from this kind of diseases, like corn, which we can remove it with Agni Karma. We will be giving a small dose of local anesthesia, so you won't get that pain. In Shalyatantra, we are integrating both. As our speaker told, we are doing this integrative medicine here. So we will be giving this local anesthesia to that area, and we will be removing this corn. And it takes almost 10 days to heal the wound. And it is almost, it won't recur much. If you do it in a proper way, it won't recur. Next, I will be showing a surgical procedure which will be awkward to show in a crowd like this. So I am just showing this before picture and after picture. Okay. So this is a case of pilonidal sinus, which is happening just between your natal cleft. There will be a hair follicle going inside your skin, and it creates infection, and this infection goes upwards, and it will be giving out pus discharges. So in this picture you can see there is a hole on the body, that is a sinus. And through the sinus we are inserting a probe, that is a probe, or otherwise called as a shalaga. We are inserting that into this sinus, and after that we are, after proper investigations, blood investigations and ECG and chest X-ray, we are doing all the basic tests before posting for a surgery. If the patient is fit for surgery, we are going for a surgery. Okay. And this disease is only cured using surgical procedure. And we will be excising that area along with that track. And finally, proper dressings will be done with our experienced surgeons. And it takes almost 3 days. First you have to come here, do the basic blood investigations, and if everything is normal, on the next day we will post for surgery. And after surgery you will be resting here, and the third day, morning, you can go back to your home, but we will be explaining all the things, what you have to do, the proper cleaning, everything should be done properly, otherwise this wound will get infected. Obviously the wound will get infected. So we will be teaching all the basic things, what you have to do. And after a couple of days, maybe 20 days, we have successfully healed that wound. And this is a picture showing a proper healed wound. Okay. In that, so many pictures are there, but we can't show all those pictures in this small presentation. So what you experience here and what makes us unique in our hospital, Ahalia, we are integrating these things, and each person will be getting an individualized surgical care plan. It's not just like randomly we are doing this. In our Ayurveda, we have a lot of medicines. We are curating your medicine, and we are seeing you as a patient, like body and mind we are dealing here. So, and the pain management, we are using the natural pain management approaches. Mostly we won't give much of allopathic drugs, but to an extent we have to use this. In our department we have to use allopathic drugs to an extent, like under antibiotic coverage only we are doing these surgical procedures, and slowly we will be migrating, we will be integrating to the Ayurveda and successfully managing this and other Panchakarma and Rasayana therapies for the proper recovery. Time okay. And we are giving attention to the mental and emotional healing as part of the recovery. Next is the outcomes we strive for. Minimal invasiveness. We are not going for a very invasive techniques. Minimally invasive and maximum healing procedures we are doing. And as I told before, recurrence rate will be less, and improved tissue generation and enhanced patient satisfaction and long-term well-being. And our care continues. Even after you get discharged from the hospital, we will be in contact with you. You can ask any doubts you are having, and proper care will be given to all the patients. Okay, that is the last slide. We are going, that is stay connected. We should be connected with the doctor who are operating on you, and that freedom you have here. You can connect with the doctor who is doing the surgery. And proper follow-ups will be done, and teleconsultations are available, and long-term wellness we are aiming for. And you can access to all these kind of sessions where you can come in this Sangamam. We are dealing with all these kinds of diseases, and you will get an opportunity to talk with all the doctors, and you can clear your doubts. And if it is interested, means you can come to the OP and clear your doubts and get diagnosed with the disease what you are having. Okay. Thank you one and all for your patient listening.
Thank you, sir. Next, we are having a yoga demonstration by Dr. Farshad KH, Senior Consultant, Ahalia Ayurveda Medical College Hospital. Dr. Farshad is an eminent Ayurvedic physician specializing in therapeutic yoga, completed his graduation in Ayurveda from the University of Calicut, and earned Masters and PhD in Yoga from Annamalai University. With much pleasure, we invite sir for the demonstration. I also invite Dr. Srilashmi EB and Dr. Anjana Krishna, House Surgeons, Ahalia Ayurveda Medical College Hospital, for assisting sir. After this section, a Kori session will be there and our food will be provided soon. Thank you.
Good evening, everyone. Thank you for being here. Okay, let's do a quick breathing session before moving to the entertainment part. The entertainment team is ready for the next their journey. Okay. Today we are going to practice a pranayama named Brahmari pranayama. Okay, that is pranayama. Everybody knows about pranayama. For doing pranayama, just I am telling everybody to, kindly request everybody to keep your mobile phone just silence for a few minutes and sit in a comfortable posture with your spine straight. Okay, Dr. Srilashmi is there, Dr. Anjana is here for doing the demonstration. After that, we can do a group practice. Okay, just a simple, it is a quick session. We can finish as soon as possible. Those who are having any ear-related issues, especially of tympanic membrane or uncontrolled hypertension, better to avoid this pranayama. Okay. Okay. എല്ലാവരും റെഡി ആയിട്ട് நினைக்கிறேன். ஓகே ஃபர்ஸ்ட் நமக்கு நம்ம ஜஸ்ட் ஒரு டெமான்ஸ்ட்ரேஷனுக்கு பார்த்துக்கலாம், அதுக்கப்புறம் சேர்ந்து பண்ணிக்கலாம். ஓகே, ஜஸ்ட் சிட் இன் ஏ கம்ஃபர்டபுள் போஸ்டர். ஓகே, க்ளோஸ் யுவர் ஐஸ், observe your breathing. Okay, then partially close your ears. Just inhale through your nostrils, exhale with a humming honeybee sound. Okay. Inhale, exhale. Observe the vibration and relax. Okay. Now, we can எல்லாருமே சேர்ந்து practice பண்ணிக்கலாம். Okay, just keep your partially close your ears. Just எல்லாரும் செஞ்சு பண்ணிக்கலாம். ஒரு 2 minutes. Okay, partially close your ears. Okay, முழுசா மூட வேண்டாம். Just simply close the ears. Okay, inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Feel the vibration and relax. Deep inhale, exhale, relax, relax. Okay, this is Brahmari Pranayama. Okay. Okay, everybody knows about pranayama. Just simply, I'm just explaining the benefits of pranayama. Pranayama means a controlled breathing, slow, deep breathing that helps to improve the lung function, reduces the hypertension, reduces the stress, and also helps to reduce the synthesis of stress hormone. Okay, these are the main importance and benefits of doing pranayama. Brahmari helps to reduce all these stress levels in your body. Okay, then next one, everybody knows about yoga. Yoga is a mind-body practice. Okay, a lot of research are there regarding yoga in current situation. Okay, it has an equal and positive impact in physical and mental well-being. Initially, yoga was developed mainly for the spiritual goals. Over the years, it has undergone a lot of changes. Okay, here in Ahalia, we are practicing therapeutic yoga. Therapeutic yoga means tailor-made yoga practices. Okay, people, the person, என்ன ரிக்வயர்டாக இருக்குது, அவருக்கு என்ன டிசீஸ் இருக்குது, அதுக்கு சேர்ந்த மாதிரி ப்ரிஸ்கிரிப்ஷன் போல் நம்ம யோகா தெராப்பி யோகாசனாஸாக இருக்கலாம், பிராணாயாமாஸாக இருக்கலாம். அது அவருக்கு சேர்ந்த மாதிரி நம்ம கொடுத்து அது அவரோட டிசீஸ் எப்படி க்யூர் ஆகிறதுக்கு இம்ப்ரூவ்மெண்ட் வர மாதிரியான ப்ரொசீஜர் நம்ம அட்வைஸ் பண்ணி அது தான் இங்கே நம்ம மெயினாக இங்கே ப்ராக்டிஸ் பண்ணிகிட்டு இருக்குது. ஓகே, தட் இஸ் அ டெய்லர் மேட் ப்ராக்டிஸ் தட் இன்கார்பரேட்டிங் இன் அஹல்யா therapeutic yoga. That is a recent advances in yoga. Okay, that's simple and we can take lower back ache. The very common nowadays lower back ache. Okay, depending on the severity of the disease, we can modify the asana according to the patient and patient condition. Okay, just simple ஒரு 3 postures மட்டும் நான் இங்கே demonstrate பண்ணிக்கிறேன். அதோட benefits என்னென்ன take care பண்ணணும் before and after that என்னது இங்கே பார்க்கலாம். Okay, first நம்ம select பண்ண போகிறது சேதுபந்த ஆசனா. ஓகே, ஃபர்ஸ்ட் அவரை டெமான்ஸ்ட்ரேட் பண்ணி பார்த்துக்கலாம் எப்படின்னுള്ളത്. நமக்கு இப்போ இந்த சேரில் நமக்கு பண்ண முடியாது, பட் ஜஸ்ட் நீங்கள் லிசன் பண்ணிக்கலாம். உங்களுக்கு ஏதாவது தேவைன்னா வி கேன் ஹாவ் எ செஷன் இன் ஹாஸ்பிட்டல், அவங்க வந்து கேட்டுக்கலாம், ஒன்றும் பிரச்சனை இல்லை. ஓகே ஓகே, இது சுப்பைன் போஸ்டர், நம்ம மலக்கப்படுத்தி செய்கிற போஸ்டர் தான் திஸ் ஒன், சேதுபந்த ஆசனா. ஓகே, ஜஸ்ட் சிம்பிளி ரிலாக்ஸ், ரிலீஸ் யோர் பாடி, ஹேண்ட்ஸ் டுகெதர், லெக்ஸ் க்ளோஸ் டு யுவர் பாடி. Okay, then just bend your knees. Bend your knees. Okay, then with support of your hand, just lift your lower back up to chest with inhalation. Okay, inhale, lift your lower back up to chest. Maintain the posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly exhale and release your posture. Extend your knees. Extend your knees. relax, relax, relax. Okay, this is Sedubandasana, the bridge pose. Okay, helps to reduce mainly it helps to reduce the stiffness over your lower back, reduces the stress over your lower back. Okay, it also, a lot of benefits are there, but mainly it helps to improve the lower back muscle strength. Okay, second one is Bhujangasana. Bhujangasana is a cobra posture. Okay, the supine posture. எல்லாருக்கும் தெரியும் பட் ஜஸ்ட் அதை டெமான்ஸ்ட்ரேட் பண்ணி டெய்லர் மேராக நமக்கு யூஸ் பண்ணால் இட் வில் பி கெட் எ ரிமார்க்கபிள் ரிசல்ட் இன் த ட்ரீட்மெண்ட். ஓகே ஓகே கம்ஃபர்டபுளாக ரிலாக்ஸாக படுத்துக்கலாம். ஆஃப்டர் தட் ஜஸ்ட் லெக்ஸ் டுகெதர், ஹேண்ட்ஸ் ஆன் either side of your body over the shoulder. ஓகே அதுக்கப்புறம் ஜஸ்ட் inhale and lift your head up to umbilicus. Just inhale, lift your head and chest up to umbilicus. Just maintain the posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly exhale and relax and relax. Okay, the cobra posture, everybody knows about the cobra posture, but there's a benefit is that it improves the circulation of the spine and our internal organs. Okay, the sciatica is super exercises, but you need to do in a condition where medical supervision. Otherwise, it will get more pain while doing the procedure. Initial time of sciatica, the Bhujangasana is very helpful, but very helpful and soothes the sciatica. Okay. Next one is Shalabhasana. Shalabhasana, the same, the prone posture. Okay, legs together. Okay, keep your both hands beneath your thighs. Okay, just legs together. Lift your both leg together without lifting the head. Okay, just observe the lower back. Just inhale and lift your both leg. Inhale. Maintain the posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exhale. Relax, 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 relax. Okay. This is Shalabhasana, the locust posture. It helps to, mainly the benefit is, it helps to improve the core muscle strengthening, the posture correction. For long time sitting, well the super posture, regular பண்ணிடுச்சுன்னா நம்ம எப்போவுமே இந்த ஸ்லெட்ஜ் பண்ணி ஒர்க் பண்ணி உட்காரும்போது சிஸ்டம் யூஸ் பண்ணி வேலை பண்ணும்போது எல்லாமே இந்த பெயின் அண்ட் ஸ்டிஃப்னஸ் வரதுக்கு வாய்ப்பு இருக்குது. அந்த போஸ்டர் கரெக்ஷன்ஸ்க்கு இந்த ஷலபாசனா இஸ் வெரி எஃபெக்டிவ். ஓகே, தட் இஸ் த ஷலபாசனா போஸ்டர். ஓகே, தேங்க்யூ. இது சிம்பிளான, ரொம்ப லேட் ஆகிடுச்சு, எல்லோரும் வெயிட் பண்ணியிருக்கிற டைம் தான். ஜஸ்ட் கன்க்ளூஷன் மாதிரி இங்கே தெராபிட்டிக் யோகா அண்ட் மெயினாக நம்ம யூஸ் பண்ணுறது along with Ayurvedic Panchakarma treatment, we can take a yoga therapy. It helps to a good result in the alleviating the symptoms and enhances the overall well-being of the patient. Okay, thank you so much for your kind cooperation in the late time itself. Okay, thank you so much. Thank you Anjana, thank you Sri Lakshmi.
Thank you, sir. Our food counter is open now on the left side of the auditorium. Our guests can enjoy it. Simultaneously, we are carry on the query sections here.
இடதுபுறமாக ஃபுட் கவுண்டர்ஸ் திறக்கப்பட்டுள்ளன. அப்போ விருந்தினர்கள் எல்லாரும் உணவு எடுத்துக்கொள்ளலாம்.
Now, we are moving on to very important part of today's program, the query clearance session. Some common queries have been collected by our team, which will be addressed in this session. I invite Dr. Anup Kumar CA, Professor and HOD, Department of Panchakarma, for guiding us through the segment.
Good evening all. Thank you for being here. Your trust and curiosity in exploring the ancient wisdom of Ayurveda were truly inspiring. This conclave was not just about knowledge sharing, it was about building a community centered around wellness and holistic health. Your engagement and support made the vision a reality. We are deeply grateful for your time and belief in the power of Ayurveda. We hope the sessions provided you with valuable insights, and we look forward to continuing the journey of health and well-being with you. Thank you.
First question, what is the difference between initial symptoms of stroke and sciatica?
As you know, these two conditions, as a stroke is called as cerebrovascular accident. நம்ம மூளைக்கு போகுது ரத்த குழல்களில் ஏதாவது அடப்பு வருக இல்லைன்னா ரத்த குழல்கள் வெடிச்சிருந்தால் பக்ஷாகாதம் இல்லைன்னா பக்கவாதம் சொல்லுவாங்க. அந்த மாதிரி கண்டிஷன் தான் இந்த ஸ்ட்ரோக்கில் வருவாங்க. ஆனால் சயாட்டிக்கா அந்த கிருத்ரசி சொல்லுவாங்க, நம்ம லெம்பார் வெர்டிபிரா சொல்லுவாங்க, நடுத்தண்டில் கீழ்ப்பக்கம் வருத பாகத்தில் இந்த டிஸ்க் சொல்லுவாங்க. அந்த டிஸ்க் கொஞ்சம் பல்ஜ் ஆகணும், வெளியில் தள்ளுனா காலுக்கு போகுது, நிறையில் அமர்த்தினா வருது அந்த ரேடியேட்டிங் டைப் ஆஃப் பெயின், அந்த நடக்கிறதுக்கு கொஞ்சம் கஷ்டம் எல்லாம் வருது. அந்த மாதிரி நியூரலாஜிக்கல் கண்டிஷன் தான் இந்த சயாட்டிக்கா சொல்லுவாங்க. One is a cerebrovascular accident, stroke, and one is a sciatic nerve compression.
Next question, sir. Whether patient can take allopathic medications along with Ayurveda medication?
Yeah, definitely. Because few medicines we can't stop. Few are lifelong supporting medicines. So we are promoting more integrative type of treatment. So along with the Ayurvedic medicine, you can continue few allopathic medicine also.
Next question, is there any risk factor if we suddenly stop medications for sugar, BP and cholesterol?
Yes, definitely there will be complications. That along with our Ayurvedic medicine, you can continue few allopathic medication. And by regular monitoring, we can taper the dosage upon consultation. But if you are suddenly stopping those medicines, it will go to some risk factors.
Is there any side effects for Ayurveda?
Definitely. In Malayalam, one proverb is there, Adhigamayal Amrudum Visham. If you are not following proper diet, not following proper patya, without a consultant's opinion, if you are continuing Ayurvedic medicine or if you are taking Ayurvedic medicine, there will be definitely complications. So you have to take Ayurvedic medicine in a proper way with the direction of a physician in a proper manner, then there won't be any complications.
Is it possible to cure degenerations completely?
That is a big question. Is it possible to cure degeneration completely? As you know, nothing is permanent in this world except change. In Ayurveda point of view, our sharira, shiryade iti shariram. Our sharira is from birth to death, there will be degeneration. But our line of treatment, our Ayurvedic type of management, we can control the speed. We can reduce the speed of degeneration. Okay.
Next question, sir, and the last one. What is Panchakarma? Is oil massage included in it?
Panchakarma means 5 types of karmas. That's mainly meant for the detoxification and rejuvenation of the body. That for the preparation of a body for doing this Panchakarma, we need oil application, steam bath, such type of pre-operative procedures. So after doing that pre-operative procedures such as application of oils and preparatory methods, we can go for the Panchakarma, like giving medications, preparing the body and making to emit with a medicine that is called Vamana. Same procedure by giving purgative drugs called Virajana. Then we are giving Basti type of treatments, like enema-like of treatments, specifically indicated for arthritic conditions. Then Nasya is nasal instillation. These are the 5 main karmas.
Thank you, sir. With that, we came to an end to the query session. Thank you, sir, for your valuable opinions.
Thank you very much.
For the kind attention of our guests, washing area is provided outside and the patients can use the exit door to reach there. There's a feedback session. If our guests are having any feedback regarding Ahalia Wellness, you can open up that here. I repeat, if the guests are having any feedback regarding Ahalia Wellness, you can open it up here.
With this, we officially conclude the formal proceedings of Sangamam 2K25. We extend our heartfelt thanks to all our guests, dignitaries, and participants for making this event meaningful and memorable for your gracious presence and support. While the official function comes to a close, the celebration continues. We invite you all to join us for a music band and entertainment to end the evening on a joyful note. Thank you all.